brains behind this operation, for real. So we wanted to kind of highlight our Visia again. It's been a while since we've talked about it up close and personal. You've heard us talk about it, you know, just in reference and things like that, but we want to actually show you what's going on with this thing, because this is amazing. We love this. We use it as a tool every day, especially for new patients. We want them to see kind of what's going on with their skin on different levels. It really helps as a tool for us to visually show people what's going on with their skin. So what people will do is they'll come in, they will take a few pictures. So chin rest here, forehead here, and then we take a picture of front, left, and right of their faces. And then we can evaluate kind of what's going on with the skin. So it shows us things on different levels. So like for instance, this, we're looking at spots, and it will show us where the spots are. It's always gonna be within that little mask that it's outlining. And it'll compare the person against 100 other people their age to kind of give them a ranking, I guess, a percentage. And what we want to see is people closer to that top of the 100 of those people. So when this one spots, you can kind of see what's going on. We can even take this off and show you off and on. We can even get up really close, show you what's going on specifically with pores. Like for instance, in this patient, you can see she's really oily. She's got a lot of that oily shine. We've got breakouts here and there. We can even point out if there's blackheads or things like that. We can tell people if they're too dry. We can actually tell people if they're not doing cleansing as well as they should. So that's spots. We can look at wrinkles as well. See a couple wrinkles here and there, tells you how deep they are or if they're more fine lines and wrinkles. We can even look at texture, so we can work on those issues for people. Usually when I zoom in, I can actually see texture as well and get really specific on what's causing the problem. Sometimes, usually, it's actually products that people are using at home, or maybe devices like the rollers or the dermaplane blades, which you'll have to look at our other videos on what we think about those things. So sometimes those are issues that are happening at home that people just don't know about, and this really helps us show them up close and personal why they need to change up what they're doing, or why what they're doing is causing more damage than actually helping the skin. So that was texture, pores. It even will show you pore size, but again, we can zoom in and really show people that as well. This one is for UV spots. Now this one's interesting. This is actually underlying sun damage. So this will actually show us what's going on underneath. The darker the spot, the closer it is to the surface. But the lighter spots on here, I mean, those are going to be coming up at some point, and we want to stay ahead of those. We want to make sure we're helping with the problem before it actually shows up and before you actually see it on the surface of the skin. Now, the other thing that we like to look at is brown spots. That's kind of correlated everything with spots, UV spots, actual pigment producing areas. So that really gives us an insight with that as well. Red areas, this is really good for patients that maybe have a lot of underlying redness, whether it's a skin condition or maybe underlying inflammation, breakouts, acne, really helps us with that. Porphyrins actually will show us how well the cleansing is, how much bacteria is on the surface of the skin. We can actually, again, zoom in really, really close and kind of show people, if I can get it to change, and kind of show people what's actually trapped in pores. So that's always kind of cool. You can see these little, I don't know, they're kind of like little neon dots all over the skin. Not the little white ones, that's kind of like just like fuzz that's left on the skin from cleansing, but from product, oil, dirt, debris, I mean, you can see it kind of lighting up everywhere. So this really helps determine if what they're using at home is really getting that face clean, especially with those makeups that, you know, really go the distance and last hours and hours for people. Sometimes you're not really getting it off. Makeup wipes tend to not get things off, you know, so we just want to really see how well people are cleansing and make some other recommendations for them to make sure that that skin is actually getting really clean. And that's just a few things we can do this. We can even show you what you would look like at 80 years old if you wanted to see that. We can compare results, lots of different recommendations. We can actually load up like skincare, print it out for you so you can kind of show it off to everybody else. So we can show side by side. People can actually come in later on and get an updated photo taken, you know, 6 months down the line, whatever. And we can actually show them side by side the difference between the first picture they took, and then the more recent one, so we can show the difference in the skin and we can show how much improvement has happened. because of products that they've been using or because of treatments that they've been doing. So it's an excellent tool. We recommend that everyone come in and get this done so we can really show you what's going on. It's important to really know what's going on with the skin. So this is one of those tools that we use here at Viva to really hone in on that and try and educate our patients. All right, angels, so hopefully you've got a good insight on this. So if you want, give us a call, make an appointment, come in and get your Visia scan done. Don't wait, we're waiting on you.